Various symptoms of a watershed stroke are similar to those of ischemic strokes. Still, due to the border areas of affected tissues, they are usually milder and more challenging to notice. The symptoms may come and go, and they can mask other health conditions. The symptoms of a watershed stroke might include facial drooping, a tilted head, weakness or paralysis of one leg, and sometimes the arm on the same side of the body. Speech impediments are related to episodes of the avulsion of speech. Common mood disruptions include uncontrollable and inappropriate laughing and crying. An individual with an ischemic stroke has blood flow restricted or cut off from different brain regions. This can deprive the brain tissue of oxygen and nutrients, contributing to tissue damage. A myocardial infarction, also known as the heart aperture, can affect the heart's ability to pump sufficient blood to the brain. The threat of stroke is particularly significant in people with carotid artery stenosis. Any condition that can cause a sudden or severe drop in blood pressure due to the loss of fluid or blood can lead to hypovolemia. This might include severe dehydration and profuse bleeding. A severe viral contagion known as sepsis spreads into the bloodstream to cause dangerous fluctuations in blood pressure. Risk factors that stem from the causes of stroke are similar to those that involve other forms of ischemic stroke. They include lifestyle factors such as diet and physical activity, as well as medical factors such as age and health problems. Aging, being overweight, inactive, having high blood pressure, high cholesterol levels, excessive alcohol use, cigarette smoking, and diabetes are all characteristics of an older age. An obstructive respiratory condition might lead to a stroke in your family. Having a family medical history of cardiomyopathy, congenital heart defects, or atrial fibrillation, you also have this condition. Strokes are diagnosed the same way regardless of what area of the watershed the stroke occurred. It begins by reviewing your medical history and performing several diagnostic tests to find the cause of your stroke. CT scans penetrate the brain and determine the cause of seizures. Magnetic resonance imaging, MRI, scan. With a magnetic field, this technology generates a highly detailed image of soft tissues using radio frequency waves and magnetic waves. It is used in conjunction with contrast dye to determine blockages or restricted blood flow in the vessels of the brain. Technology that uses reflected sound waves to create detailed images of blood vessels and soft tissues is Doppler ultrasound. This device can reveal strokes produced by clots and narrowed blood vessels. CT angiogram and other tests may be used to assess risks relating to ischemic stroke, including cholesterol levels, triglyceride levels, and blood clotting levels. Cascade strokes require emergent medical attention to prevent serious brain injuries. The therapy may change according to the reason for the impending stroke as well as its severity. If a blood clot triggers a plight in the watershed, you might require the administration of blood thinners to help blood flow through it. If you have already recuperated fully, you might be a candidate for TPA, an agent given intravenously, through a vein, to dissolve a clot. If blocking is due to carotid stenosis, a surgical procedure known as carotid endarterectomy can enlarge the carotid artery and increase blood flow. Another option is inserting a tube, called a besieged catheter, into the blood vessel. Once inserted into the obstructed spot, the balloon catheter is inflated to widen the plate. A mesh tube, called a stent, is then placed in the blood vessel to open the artery. If severe blood loss or poised blood pressure triggered the stroke, your treatment might focus more on maintaining adequate fluid levels and blood pressure with intravenous, fluids or blood transfusion. Matthew, the video creator, is an 83-year-old cancer/stroke survivor who received his Ph.D. at 65. Would like you to know his passion for helping others by spreading good health